So I'm going to be showing an inferior glide, the arthrokinematic method that I'm going to be pre-positioning the patient's arm in the available range into abduction, slight extension, and slight external rotation. My goal is to help improve inferior capsular mobility to improve abduction. I'm going to stand by the patient's head. I'm going to come in. This is an arthrokinematic grade 3 mobilization. So I am going to be going in that line connecting perpendicular to the coracoid process and posterior acromion, going kind of in an oblique lateral direction, not straight inferior. I'm coming in. Again, this is a grade 3. So I'm going to line my forearm and my hips up in the direction I'm going to go. I'm going to come in, pre-position in his available range of abduction, slight extension, slight external rotation, and I'm going to be performing my glide. As I'm gliding in an inferior direction, I'm going to be bringing his elbow up. Good. And try to relax for me. Thank you. If my patient is experiencing impingement symptoms, I can do an alternate. Instead, I can change to a target tissue. Now I'm going to internally rotate here. My direction remains the same, but now I'm going to translate his humerus instead of swing. So I'm going to come in, same direction, but this time my elbow and shoulder are going to move together. And I'm going to come in and I'm going to glide. So I can do here a grade 3 or a grade 4 static hold. And for someone experiencing impingement symptoms with the previous one, this is a nice option. Or I can do both in the same treatment session. I follow this up with neuromuscular reeducation. So I'm going to guide the glide. I want to come up into his available range that we've gained. So we're going to come up and I'm going to just gently persuade that humeral head in an inferior direction. Good. So I can start passively. Then I can do active assistive. Help me out. Good. And again, gentle persuasion. I'm not mobilizing the joint. And then I can come up, I can ask him to hold here, agonist into abduction, antagonist, and agonist, and release.